Right. So my name is Risha Irvin, and I'm an assistant professor in the Division of Infectious Diseases, where I really focus my clinical care, research, and community engagement projects on improving the health of vulnerable populations impacted by HIV and hepatitis C virus. At Johns Hopkins, I also serve as Associate Vice Chair for Diversity and Inclusion for the Department of Medicine, and I'm the Director of the Baltimore HIV Collaboratory for the Center for AIDS Research, where I lead pipeline programs. I also lead Sharing the Cure, which trains primary care, HIV, and substance use providers to treat HCV infection to improve access to HCV care. My R01 focuses on HCV elimination in incarcerated persons, and I've been doing that work in both Maryland and Louisiana. I think finally, as we all know, COVID-19 has impacted all of us over this last year, and I've been working with the COVID-19 Prevention Trials Network, both locally and nationally, and serve on the COVID-19 Vaccine Health Equity Group at Johns Hopkins. So that's a little bit about me.
Thanks, Risha. I'm Damani Piggott. I'm an associate professor in the Division of Infectious Diseases at the School of Medicine, with a joint appointment in the Department of Epidemiology at the School of Public Health. I work clinically taking care of patients with HIV and other infectious disease conditions. My research program centers on understanding the biological, behavioral, and structural pathways necessary to improve life outcomes for those living with HIV, particularly for those in highly vulnerable spaces in our society. I have particular focus on the epidemiology and biology of aging phenotypes, such as frailty, and do work as well in the gut microbiome space. At Johns Hopkins, I also co-direct the James A. Ferguson Emerging Infectious Diseases RISE Fellowship Program, a program sponsored by the Centers for Disease Control and Prevention to attract and connect diverse talent to public health careers. I also serve as Associate Vice Provost for Graduate Diversity and Partnerships and Director of the recently announced Vivian Thomas Scholars Initiative. I completed my undergraduate degree at Morehouse College in Atlanta, Georgia, the brother college to Dr. Irvin's Spelman College for her undergraduate degree. And because of clinical and research experiences as an undergraduate student in the academy here in the US, in the Dominican Republic, and working on HIV and prison populations at the Centers for Disease Control and Prevention, I went on to pursue a joint MD PhD degree with a PhD in immunology. With an initial interest in global health, I went on to do residency in internal medicine and pediatrics. And along the way, I had several research and clinical experiences in Mali, West Africa, South Africa, in Trinidad and Tobago, and here in the US, ultimately working on HIV. And that led me here to Hopkins over a decade ago to pursue training in infectious diseases as a fellow in our program with an HIV focus.
So, Damani, what do you love about the Division of Infectious Diseases?
Yes, Risha. So I came to Hopkins and the Division of Infectious Diseases really for the tremendous intellectual resource, the exceptional clinical training, and the depth of research opportunity that exists here. I have stayed consequent to the strong mentorship and remarkable community of people at multiple levels who have really made my own life so much richer throughout my time here. Hopkins is an excellent place to do science, and we have in our ID division such a diverse array of exceptional scholars who really work with deep resolve across the full breadth and depth of infectious disease conditions that challenge our human existence, as we see with COVID-19 here today. Our colleagues are really completely devoted to the work that they do in joint mission, and both historically and contemporaneously, through a range of scientific discoveries and clinical contributions, have really had just transformative impact in lifting up our nation and our globe. They're exceptional scientists and physicians, wonderful colleagues, and just tremendously warm, generous, and genuinely kind human beings, fully devoted to a larger humanity. Our fellows, similarly, are absolutely phenomenal. They're phenomenal in the richness of their unique and diverse life trajectories that just brings so much to enhancing training in our program. enhancing patient care delivery, and ensuring that we have really strong community here in our space. So that's really, for me, what I really love about our division of infectious diseases and the broader space. And Risha, in Reflex, I would ask you, what do you love about the Division of Infectious Diseases at Johns Hopkins?
So I think pretty, similar to you, I love the Division of Infectious Diseases really because of the people. I think we have such a great group of both faculty and staff really committed to serving the community and improving access to high quality healthcare. I think the COVID-19 pandemic even highlighted this more. There was so much teamwork and people just coming together and stepping up to really, combat the pandemic that we were undergoing and that we're still in. I also love our division because we're really at the forefront of discovery. When you think about the work being done on organ transplantation from HIV infected donors to HIV cure research, to tuberculosis research, Hep C treatment research, and really the full span of bench research, clinical research, and even community engagement research being done in our division. And it really just seems like there's a place at the table for everyone. And there's also this very much kind of collaborative nature of work, and that you can really reach out to anyone and get help. Lots of partnerships and mentorships between different fellows and faculty. And even, so many people have been so helpful for me, from senior faculty to other kind of peer mentors and other folks that I work with. And so it's really just been a wonderful experience for me, and just really happy to be a part of our Division of Infectious Diseases. So now maybe, let's turn and chat about our respective work in the field of diversity at Hopkins. You've served in the Dean's Office, and now you're Director of the Vivian Thomas Scholars Initiative and Associate Vice Provost for Graduate Diversity and Partnerships. Can you tell me a little bit about your work in the Dean's Office and some about your new role as well?
Thanks, Risha. So yes, it really has been my distinct pleasure to have served as Assistant Dean for Graduate Biomedical Education and Graduate Student Diversity at our School of Medicine previously. So in that prior role, I really had the honor to work with an immensely dedicated cadre of people here at Hopkins, really who were intently committed to capturing the exceptional diverse talent that exists across our full society, and really connecting that talent to our training pathways. And in so doing, really fostering opportunities for core knowledge acquisition in science and medicine, promoting experiential exposure to scientific research, really driving forward motivation for self-identification with, and a true sense of belonging to the scientific and the medical profession. And helping those in our training pathways successfully navigate the pathway to a biomedical career and to leadership in the biomedical field through mentorship, sponsorship, and holistic support in ways that ensure that those really journeying here with us at Hopkins thrive fully, both professionally and personally alike. I now have the privilege of directing the recently announced Vivian Thomas Scholars Initiative here at Hopkins. This is a $150 million investment in STEM graduate education and future STEM leadership, made possible through the generous support of the Bloomberg Philanthropies. And at full steam, this gift will support in perpetuity 100 new positions for students from historically Black colleges and universities and other minority serving institutions to pursue STEM graduate training at Hopkins in one of our more than 30 STEM PhD programs, with full financial, academic, mentorship, sponsorship, professional and career development, and community support. It's additionally going to support expanded summer undergraduate and post-baccalaureate research program experiences here at Hopkins to excite students from HBCUs and MSIs in their journey in STEM, and to advance these students to assume ultimately leadership roles in our STEM enterprise more broadly, which is going to be to the betterment for us all and across our entire society. We know that HBCUs and other minority serving institutions long have done an exceptional job of nurturing and supporting diverse scholars who go on to pursue STEM graduate training and to be leaders in STEM across academia, government, industry, and beyond. And for us in the Vivian Thomas College Initiative, it's an honor and a privilege to be able to partner with our HBCU and MSI colleagues on this effort and to really have the benefit of their wisdom and experience in informing this effort and carrying us forward again in the STEM space and to advance us in terms of our medicine and science. So I would actually also then ask you, Risha. I know that you've also been involved in diversity work at Hopkins in just really profound and tremendous ways, I have to say, for which we are very, very grateful. Can you tell me about your work with the Centers for AIDS Research and about your new role as Associate Vice Chair for Diversity and Inclusion in the Department of Medicine? And how might you interact with the ID fellows in this role?
Sure. First, again, just want to acknowledge, what an inspiration your work has been to me. And, I have worked with the Center for AIDS Research, or as we call it, the CFAR, since my arrival at Johns Hopkins, really on pipeline programs. And I've had this commitment to really training kind of the next generation of health professionals committed to combating the HIV epidemic. Our undergraduate programs at the CFAR really focus on first generation college students and those who are underrepresented in health professions. And they come to Johns Hopkins to get training in research, but also in community engagement, because we want to make sure that people understand the communities that they're a part of and that they value, collaborative community efforts. We have both kind of faculty and fellows that come in and lead many of the sessions with our students and teaching about a diverse array of topics pertaining to HIV primarily. But we also invite our faculty and fellows to come out in the community with us to do HIV and hepatitis C testing as well. And so I think it's a great program to really get kind of our students and kind of faculty and fellows involved. I've also taken on kind of a new role, as you mentioned, this year as Associate Vice Chair for Diversity and Inclusion in the Department of Medicine and serve as chair of our Diversity Council. I had been a part of the Diversity Council for several years and really excited to take on kind of this new role where my work is really focused on the recruitment, retention, and promotion of faculty and trainees underrepresented in medicine. My charge is to really do all that I can to continue to work to create the most supportive environment that is really defined by diversity, equity, and inclusion, and something that we've been really working on here at Johns Hopkins. So excited to be a part of that work more broadly. We do this in the Department of Medicine through seminars, social gatherings, visiting clerkships and visiting professorships, health equity courses, leadership sessions, to name a few things. And we're continually expanding that work as well. And so really looking forward to kind of all the work we'll do in this area as well.
So grateful again, Risha, for your just tremendous leadership in this space and to being such a beacon for us in moving this all forward. I know personally just how much of a force you have been in this space. And I know further how much of a force you've been as well, appreciably over the last more than 16 months, as we have faced the tsunami that is SARS-CoV-2, COVID-19. And appreciably for us in the infectious disease world, a good portion of our time has been directed towards facing the challenge and trying to meet the challenge of this pandemic. And I know for you that a good portion in part has been committed to dealing with considerations of health equity as it relates to COVID-19. I wonder if you could talk a little bit about this work.
Yeah, so, I think, COVID-19 for all of us has really defined this last year or more for us. And I think one of the things that many of us recognized early on at Hopkins is that, health equity would have to be a part of that work and a part of the conversation as we tried to combat COVID-19 and then as we moved into COVID-19 vaccines as well. So we've done a lot of things at Hopkins around this issue. One, we formed some community affinity groups focused on COVID-19 education strategies. I've led one of those groups focused on African-American faith and community leaders. Really kind of bringing the group together to talk about how we could get information out in the community so that individuals can make informed decisions. We've also held numerous community forums that many of our faculty have pitched in to lead across Baltimore and across Maryland, again, to make sure people were getting the information that they needed and that people would be able to answer questions about anything they had about kind of COVID-19 and COVID-19 vaccines, and just really working to get information out there in the community and forming community partnerships. We also formed a COVID-19 health equity task force focused on vaccines. And that work has been both internal to make sure our strategies were equitable in terms of vaccine distribution internally, but also working externally to partner with other kind of government agencies, community-based organizations, again, to make sure that we not only had information out in the community about COVID-19 and vaccines, but to also make sure that people had access to vaccines if they wanted to get one. I think this work has been really important as we think about COVID-19 health disparities and the data that we've seen across the country. But as we hone into our data right here in kind of Baltimore and in Maryland more broadly, and then also concerns about COVID-19 vaccine inequality. And so making sure we're at the cutting edge of equity and making sure we're hearing community voices and understanding what the community needs and how we can partner with the community. And so I think that work will continue. Damani, what do you see as the work that still needs to be done around COVID-19 health equity?
Sure. And Risha, those points that you raised just are so resonant as we think about this pandemic again. And I think the pandemic has been a truly singular stress event that has exposed in stark relief the unacceptable disparate vulnerability within our communities. It has in many ways placed a harsh spotlight on where we've been, where we are, and the really significant work that needs to take place to get us to a more equitable future. And so I think just reflecting on the question, as we consider the work that still needs to be done around health equity relative to COVID-19, I believe we need to consider both the local space and the global space. We know that this virus has had disproportionate impact in multiple jurisdictions to those who have been long vulnerable to poor health outcomes. The virus also has reminded us yet again that infections generally do not respect country borders. Mm-hmm. And so combating this virus has to be a joint and must continue to be a joint global effort. And so really to achieve protection for each and every one of us and all our loved ones against this devastating virus, and for each and every one of us to get back to a less restricted and better quality of life, to be able to enjoy the time and the activities that we love with the people that we love, we really have to maximize, I want to say, COVID-19 vaccination across our full global space with a full equity lens. That's absolutely critical. And I think in view of that, we need to circle back to the basic belief in the fundamental value and dignity of all persons. And in so doing, we have to work harder to ensure that every person in every single corner of the world has the opportunity to be vaccinated, just as a basic human right. And so I think also as we look with both local and global view, it's critical for us to take a deep look into who has access to care and who does not, who has opportunity to achieve their full health potential and who does not, and a critical imperative to close these access and opportunity gaps for the benefit, again, of our full humanity. And I think as we push forward in the fight and look at the road ahead, we really have the absolute moral imperative to not leave anyone behind, not only as it relates to COVID-19, but I have to say, also as it relates to equitable opportunity for good health for all more broadly. And I hope that the lessons from this pandemic and the lights that have been shone on this issue of equity actually expand across our entire health space as well. Great. So it's just going to, as we transition from that note, in aspiration, I want to ask a question about why do you believe that diversity, equity, and we talked about equity a bit there, and inclusion are important, and what do you see the role of Johns Hopkins as a potential leader in these areas?
Yeah, so, I think diversity is so important. And I think for some, it's a tagline or checking a box, but I think, we have to think about diversity in the sense of bringing everyone into the table and why that's important. I think what we've tried to do at Hopkins is recognize that we all have diverse experiences that have shaped our lives and shaped how we kind of think about things and how we view things. And so when you have people coming to the table that have those diverse experiences, they can bring different viewpoints and different ways of seeing things. And ultimately, I think that helps us better serve our patients and create kind of more equitable healthcare for them. And that's really our mission, to provide high quality healthcare to everyone so that everyone has access to that. And I think we do that by having a diverse workforce. And so I think a lot of the work I've done and you've done and so many others at Hopkins is focused on that so that we can ultimately, have kind of equitable healthcare for the people that we serve in our community. And I think, again, Hopkins is really working in these areas and has prioritized this work. I think as we look at equity, and we talked about that in the sense of how we serve the community, I think there's a lot of other work that's gone on at Hopkins around equity, even when we think about gender pay equity, for instance, and making sure that everyone, is having kind of the same financial outcomes when we think about kind of the work being done at Hopkins. And also as it relates to gender, looking at kind of leadership positions as well. And so I think those are some of the areas that Hopkins has really been a kind of a leader and at the forefront on. And moreover, when we think about our Department of Medicine, we're really one of the first departments of medicine that had an associate vice chair for diversity and inclusion and for the Women's Task Force as well. In the country. And so that's really important, but not only to have these positions, but to also have funding attached to these positions so that you prioritize the work being done by the groups as well. And so Hopkins has really been a leader in that area. And again, I think when we look at inclusion, Hopkins is really, again, at the forefront as we work to make sure we have an environment for both faculty and staff that's inclusive. I think that's a continual learning process as we all, again, work to learn from each other and confront, hard issues sometimes. And I think, over the last year, when we've talked about kind of the racial reckoning that our country has been in, Hopkins has led, Hopkins-wide forums on this, but we've also done forums in our Division of Infectious Diseases and kind of small group learning on issues confronting kind of racial bias. And so I think those are things that we'll continue to do and that we'll continue to engage in conversations so that we can all kind of be better as we think about inclusion as well. And so again, I think, I'm really excited to be a part of this work and, to have these difficult conversations because I think it makes us all better. And I think, the leadership of our division has prioritized that. And so really excited for all the things that can come out of that work. And so I'll pose the same question to you. Why do you believe, kind of that diversity, equity, and inclusion are important? And how do you think that Hopkins has been a leader in this area?
Sure. Thanks, Risha. And I completely agree with everything that you shared and would echo it in definitive force. I think as scientists, we want to follow the data, right? And so based on definitive empiric data, we know that diversity, equity, and inclusion form the bedrock of our ability to harness the full range of human creativity, innovation, and talent, really necessary to achieve, as you mentioned, Risha, the best medicine and the best science. And in fact, to achieving excellence in all endeavors across our human enterprise and existence in our local, national, and global space. It's the really interweaving of diverse experience and innovation and thought that really gives maximal fuel to our collective ability to critically improve the human social condition for all. And if we are to truly maximize the impact of medicine on humanity and capture the full impact of diverse experiences, perspectives, and skills in our biomedical enterprise, we have to extend our reach to support and nurture everyone across our full humanity in their life journeys. And so I think embedded within our division, our school, and our university is this commitment, a strong commitment to these precepts, to advancing these considerations, to capture that exceptional diverse talent and connect it to our space, for us to be connected to it, as again, we seek to work in joint force to lift up our nation and our globe. And to advance inclusive excellence in our space. And there are excellent resources in our space to advance these goals. And so some of that, appreciably, there is sort of physical and infrastructural resources. I think though, beyond the physical and additional infrastructural resources, ultimately, there's a fundamental recognition that it's the rich and diverse tapestry of our human resource within our space that is definitively our ultimate strength. This lies at the core of the values and mission of our division and the institution at large as well.
Thank you for sharing. So I think, as we focus in on, our kind of fellowship and our, experiences here at Johns Hopkins, what do you believe has led you to thrive at Johns Hopkins?
Yeah, so thinking about that, across my journey over these last several decades, I felt deeply privileged to have borne direct witness to the tremendous value those from all walks of life have brought to education, to science, and to medicine. And that has been very much part of my experience here in the Division of Infectious Diseases and in our broader space here at Hopkins. I believe strongly it's the coalescing of those journeys that has made our space so rich and allowed me, and I want to consider others in our division and across our institution to thrive along our academic, professional, and life paths. What has particularly brought much light for me during my sojourn here at Hopkins has been also our trainees. I think one of my greatest joys and privileges here has been to bear witness to their outstanding scholarship, their clinical and research excellence, their dedication to service and to community, their leadership and their advocacy, particularly around ensuring that we continue to work hard to make our community better, both internally and externally alike. And I think those who join us in our training pathways really inspire me every day in all domains. Their contributions to our mission of discovery, as you mentioned, Risha, and clinical excellence are just phenomenal. And they are just such tremendous beacons for all of us as we navigate this life journey. So in really reflecting on our division here of infectious diseases, on our Hopkins community at large, again, our greatest strength has and will always be the diversity of our people. Those whose diverse histories, diverse identities, and diverse lived experiences just bring tremendously rich perspectives and talent to bear to advance our scientific, clinical, and community missions alike. And we know that both internally within our community and across, again, our full humanity, we are definitively stronger and better together. So Risha, in closing, I'd like to ask you the same question. What has led you to thrive at Johns Hopkins and in the Division of Infectious Diseases?
Sure. I've so enjoyed my time here at Hopkins. And, for me, I actually came from HIV policy. So when I initially transitioned to the academics, I was really unsure of my pathway. And what's really, helped me profoundly is just all of the mentorship that I've been able to have in our division. And that's both from my kind of primary mentors who have really worked with me to kind of build out my science, but also just so many other both senior and junior faculty in our division who have helped me kind of find my pathway with respect to kind of science, with respect to kind of my diversity pursuits, my community engagement, and that people have always been willing to be so collaborative and to work with you and to guide you and to help you kind of figure things out. And so that's been wonderful for me. I think the other thing you mentioned is just in terms of our trainees. I just sit kind of in awe of both our fellows and our residents and kind of all the research trainees in our division as well. Everyone is just so driven to kind of provide, high quality care. And to also, again, be kind of collaborative and kind of work with people. And so it's just so amazing, I think, to be a part of that. And I'm continually so just excited to take part in that. I think also, our Division of Infectious Diseases just really has a commitment to the community around us. I think sometimes Hopkins gets a lot of notoriety for some of the global work being done, but there's also a lot of great work being done kind of right here in Baltimore, and a strong commitment to the community that surrounds us. And that's, obviously inside the hospital and the work that's being done, but also kind of the community engagement work that's being done. And I think that's so important. And I think, in coming here, you not just get kind of a wonderful kind of education and opportunity to collaborate with people in the division, in the hospital, and on research, but really to collaborate on what's going on in the Baltimore community and in Maryland. And so I think that's something that's really remarkable for an academic center. And I think, something that will, again, continue to grow all of this work. And I'm just really excited for everything to come.
Great. Well, Risha, we've traveled long journeys in the same path, and we've crossed over in many different spaces along our journeys in life, I know. And I can say that this journey here at Hopkins absolutely has been just a joy and pleasure to continue to traverse this pathway here with you and all our colleagues and our fellows and our trainees and everyone else in this space. And it's been just wonderful to have this conversation today with you.
Thank you so much.